What is up, everybody? We are out here in the garage today because I got some feedback on some of the ulnar nerve transposition videos. There's a person that wanted me to show my favorite stretches after surgery that helped me get my elbow to full extension. So I'm gonna show you a couple of my favorite stretches, but then I'm gonna tell you what I really think got my elbow to full extension. So this is not specifically advice for somebody who just had the surgery to go out and do. I definitely recommend following your surgeon as well as your occupational and physical therapist guidelines, but these are some of the ones that really worked well for me. So I had the ulnar nerve transposition as well as the release of the Guyon's canal. So in the beginning, my elbow was very tender, and you don't want to put a extreme load on that tendon by like stretching with your elbow as stretched as you can, because as you do stretches, it's gonna really put a lot of load on that tendon. So the first thing that I did was I had my elbow bent and against my body, and I'll just slowly bend my wrist back. You know, put my fingers on my fingers, getting that real full extension. At first, I couldn't barely even like go like this. But then over time, I got it all stretched. That's gonna help open up that wrist canal, as well as put some stretch on these flexor tendons without putting too much load right here at the medial epicondyle where the repair was made, where all the work was done. So that's the first one. And as you're stretching this, you want to get that, you get the stretch here, but you want to also stretch up here to keep them even. So you just bend it back that way. That might feel a lot easier to do because it's stretching an area that wasn't part of the surgery. So I'll just do these, hold for 10, 15 seconds. And that one was like key in the beginning to get a stretch without really having a lot of pain. So that would be my number one, and I guess my number two, because you want to flip it back over here. Then as you progress further, they're gonna want to work on getting that elbow straight. But like I said, only when you're ready. So this is a stretch that I really like to do. I wasn't getting full extension for a while. I would keep this little buckle in my elbow, and I think it's kind of normal because I think my other elbow does it as well. But this one really helped me get to the point where they're even. So this is just like a table or block or whatever. Put my arm down like this. Show you that view so you can see. So my hand is like this, straight down, probably pointing towards like 10:30, 11 o'clock. Then as you can do that and that stretch feels pretty good, I just take my hand on the elbow and I'm not even pulling at all. Like this, I wouldn't even be able to move anything with this amount of pressure, but I'm just putting a small amount of tension on that elbow to try to, you know, get it to straighten a little bit. And that's all I do. Then I let my hand off, let it kind of relax for a minute, put it back down and just pull just a little bit. I really like that one. That one helped a lot. It felt really good when I did it. So that would be, I guess, number two. We'll call this and this one stretch. That's number two. This next one, I don't recommend doing till you're pretty further along in your recovery, but because a lot of you probably learned about the Batman, that little ulnar nerve floss. So it's similar to that, but it's a stretch. It's a stretch that I learned because I would go to all these different therapists and they do these stretches on me and I'd be like, wow, that one felt really good. So I would do it to myself. So you're back in this position, but you're bringing this up towards your ear and you're trying to keep your elbow back. So if your elbow's way up here, it's not going to do much of a stretch. So you try to keep your elbow back and then just stretch this up. Just a nice stretch. Not a lot of tension on it, just a nice stretch, and then release. So from here, you're right here, trying to bring this hand. You might only be able to go to here right now, or you might come up and be like, ooh, well, just bring it there. Bring it back down. Bring it there. But as you progress, get that all the way up there. Keep that elbow back, kind of in a straight line with your shoulders, so it's not forward, but not real far back. Just a nice stretch, and that's going to really help stretch out those flexor tendons, kind of get that ulnar nerve moving around again. But again, nerves are from what I've learned from experience, they're very particular and they get angry easy. So take it really easy. Right now, I'm taking it a little easy because I had a hard week of work last week, and then all weekend I was painting in my bedroom. So I'm a little sore, a little tingly, but I'm not super concerned. It's only been a few months, so this is part of the recovery process. In a month from now, I'll be even further along, and so will you guys. So those are my favorite stretches. Now you might be like, well, wow, Brian, like that doesn't really help me. Like that didn't help me get my elbow straight. Exactly. The only thing that's going to get your elbow straight is time and following the steps that they tell you to take. Do every single thing that they tell you to do every single day, and you will get the results that you're looking for. But this is one that I promise you, do not neglect. And this would be the tricep extension. This is the one that was most uncomfortable for me to do after surgery, but I feel helped get that elbow straight. So once you're able to do this kind of stuff, it's that, let me see where I'm at for you. It's that tricep extension where you're just coming down, locking that elbow out. This one I felt really woke up that tricep, woke up those tricep tendons, and got everything kind of unlocked and working again. But you can't really do that until you're a little bit further along. So just be patient with yourself. You're not going to be able to get full extension a couple weeks after surgery. It's not going to happen. And if you try to do it, you're just going to aggravate it. Like me, you remember the videos? Like 3 weeks after surgery, I'm out on the job painting baseboard. Like, what the heck was I thinking? Well, it ended up setting me back almost a month. So don't do that. Follow the steps they're telling you to take. Get your stretches in. Make sure you're getting all of those motions in they're telling you to do every day, and you'll get to where you want to be. I'm feeling really good. I'm at the point where I'm starting to push it a little bit to find out what my limits are. And then if I'm sore for a couple days after that, I know just to dial it back a little bit. But I feel really good. 80% of my issues are solved by having this ulnar nerve transposition, as well as the release of the Guyon's canal. I believe I still have some tendonitis in the elbow and some stability issues that are only going to be resolved by strength training. So that's the mission that I'm on, guys. I'm on this rebuilding of my body. I've abused my body for my entire life, beating it up, hitting things, doing crazy stuff, jumping off stuff. So I'm in the rebuilding stage now, and I'm really excited for it because I feel like I got the surgeries that I needed to get in terms of my knee and my elbow and wrist so that I could have a clean slate moving forward. But I really feel it's going to be the strength training of those particular tendons and flexor tendons and the stuff that you don't, not big biceps. It's really the physical therapy stuff that I'm going to be doing for, the rest of my life to really strengthen up all of these ligaments, all of these joints, and get to the place where I'm relatively pain-free. I just signed up. I'm like 2 weeks into the ATG program, the knees over toes guy. I don't know if any of you guys know him, but he's uber famous for helping people with knee issues get to the point where they can be A, more athletic, and B, pain-free. So I've joined his program. I'm about, like I said, 2 or 3 weeks into it, and it's tough. It's definitely pinpointing those areas in my knee and my hamstrings and my calves that I purposefully avoided before surgery, excuse me, and after surgery, because these are the areas that caused me a lot of pain, so I avoided them, and that's not going to help anything. So working on strengthening all that stuff. If you guys have any questions about really anything in terms of like physical therapy or working on strength training, I'm really diving deep into this stuff and seeking out people that have a lot of experience and following the things that they're teaching me. So I'd love to be able to give that back to you guys. Like always, like this video so other people can find it. Leave me a comment of some of the stuff that you'd like to see me talk about. And like always, hit that subscribe button. This is for that subscriber that was looking for the stretch videos.